right, part 2 of the osteology lecture, same learning objectives. We are going to start talking about the vertebrae, individual vertebrae. So in a typical vertebrae, a vertebra is the singular, vertebrae is the plural. In a typical one, you have a body, which is a cylindrical bone mass. The body of the vertebrae serve as a primary weight-bearing surface throughout the vertical column. There is an intervertebral disc, which is in between two vertebrae. It's a thick ring of fibrocartilage with a soft center, serving as a vertebral column shock absorber. So I said in the last lecture that we lose height as we get older. Part of it is lost in our intervertebral discs. An interbody joint is formed by two vertebral bodies and the interposed intervertebral disc. So the picture here is of an interbody joint. So if you have a single vertebra, you can't have an interbody joint. The individual disc is named for the two vertebrae that it's between. So in this picture, it's T6 and T7. So we would refer to that as the T6, T7 disc. Okay. So the vertebral canal is posterior to the body of each vertebra, and it houses and protects the spinal cord. Remember my little saying about how everything important is encased in bone? Spinal cord is encased in bone. The pedicles are short, thick projections of bone connecting the body of the vertebra to each transverse process. The laminae are thin plates of bone forming the posterior wall of the vertebral canal, and they connect each transverse process to the spinous process. So that makes that canal, that opening that the spinal cord runs through. The body, the pedicles, the transverse processes, the laminae, and the spinous process all form that ring. And when stacked together, we have a canal that the spinal cord runs through. All of the vertebrae have superior and inferior articular facets. You can say facets or facets, I don't care. Either one is acceptable, I say facets. The inferior facets of one vertebra articulate with the superior facets of the vertebra below it. Two facets together, one inferior of one vertebra and one superior of another vertebra, form a facet joint or an apophyseal joint. Those are two different names for the same thing. And those joints help guide vertebral motion. When we talk about the individual segments of the spine and the vertebrae of that segment, I will talk about how that happens. The intervertebral foramina is between adjacent vertebrae, and it forms passageways for the nerve roots entering or exiting the vertebral column from the spinal cord to the periphery. So you can't have an intervertebral foramen unless you have two vertebrae. So the two vertebrae stacked together form that whole, and the whole chain of them are foramina is the plural, foramen is the singular. So the intervertebral discs consist of a nucleus pulposus, which is the gelatinous center of the disc, and it dissipates and transfers forces between consecutive vertebrae. The annulus fibrosus is 10 to 20 concentric rings of fibrocartilage that encase the nucleus pulposus. So it's a pretty strong structure. That having been said, most of us have, we're over the age of 30, we have some damage to our annulus fibrosus just from wear and tear. So a herniated disc is not an unusual, it's actually quite a common diagnosis, and I'll talk a little bit about it later in the lecture. The analogy that I like to use for intervertebral discs is I say it's like a stale jelly donut. The annulus fibrosus is the dough part, the donut part, and it's stale because it's tougher. And the nucleus pulposus is the jelly part. Okay, so normally you want your jelly to stay inside your donut, and we'll talk about the consequences when it doesn't. There's a nice diagram in the book on page 183 where 183, sorry, where it shows the distribution of forces through the disc, which is kind of nice. The vertebral end plate connects the intervertebral disc to the vertebrae above and below, which helps provide the disc with nutrition. So, of course, anything in our body, it's all living tissue. We need a blood supply to bring nutrients in and fluids in and take waste products out. So, when we're specifying vertebrae and intervertebral discs, the individual vertebrae are numbered by region in cranial to sacral direction. So we start with C1 through C7, and then we have T1 through T12, and then we have L1 through L5, and S1 through S5, and the coccyx, we just say there's one of them. So the intervertebral discs are described by their position between two vertebrae. So the disc between C4 and C5 is the C4-C5 disc. The disc between T12 and L1 is the T12-L1 disc. And the disc between L5 and the sacrum, or S1, is the L5-S1 disc. So spinal nerves are described much in the same way as vertebrae. However, there's a difference. So in the cervical spine, the spinal nerve emerges above the vertebra that it's named for. So the C1 spinal nerve emerges above C1. C2 emerges above C2. C3, C4, C5, C6, C7. When we get to, there's a C8 nerve, but there is not a C8 vertebra. So C8 nerve emerges between C7 and T1, so above T1, basically. So when you get to the thoracic spine, starting from the thoracic spine and down, the spinal nerve that's named for that segment emerges below the vertebra it's named for. So below T1 is the T1 spinal nerve. Below T2 is the T2 spinal nerve. So that C8 spinal nerve shifts everything down to below the vertebra. Hopefully that makes sense. So now we're going to compare individual vertebrae from different regions. There is a super good chart, I love charts, on page 184. It's the osteological features of the vertebral column. It talks about each type of vertebra or groups of them and what's special about them, what their superior and inferior articular facets are like, what their spinous process is like, what the vertebral canal is like, what the transverse processes are like, and then general comments about them. So that's a good chart to study from. If you're going to study for the exam, that's a great start to study from. So starting at the very top, the atlas, C1. So it's called the atlas because Atlas was holding up the weight of the world. That vertebra is holding up your head, or it articulates with your cranium. So this picture is actually of C1 stacked on top of C2. And C1 is the vertebra that doesn't have a body. It's the only one that doesn't have a body. It's two large lateral masses connected by anterior and posterior arches. So if you pick up C1 and you're not sure which one's anterior and which one's posterior, there is an anterior tubercle on the atlas, and the part that articulates with C2 that you can identify, and the superior articular facets that articulate with the occipital condyles, those are on the anterior side. Okay? That's how you tell which is anterior and posterior on C1. So when you get into the lab, grab yourself a C1 and a C2 and check them out. C1 is also the only one that doesn't have a spinous process. There's a little nub, but that's all on the posterior arch. It has two large concave superior facets sitting on top of their lateral masses that accept the convex occipital condyles, forming the atlanto-occipital joint. It has the largest transverse processes in the cervical region, and because it's a cervical vertebra, it has those transverse foramina, the little holes in the transverse processes, and we'll talk about their function in a minute. So C2 functions as the vertical axis of rotation for rotary movements between the head and the cervical region. C1 works on flexion and extension of the head because of the way those facets articulate with the occipital condyles, and it does rotation with C2. So C2 is the vertical axis of rotation. The superior facets of C2 are relatively flat, and they allow the atlas to freely rotate over the axis, so we can turn our heads. It has a bifid spinous process. That means it separates into 2 points, and the bifid spinous process of C2 is very broad and palpable. Will I ask you to palpate it on the practical? Probably not. But if you wanted to, it's there. You can palpate it. We can practice in lab, but I'm not going to ask you that on the practical. So the whole point of C1 and C2 is that rotation of the head and neck, and they're different. So take a look at it. The axis, the process that articulates with the atlas is called the dens or the odontoid process. That'd be a good thing to be able to identify on the bony landmark portion of the practical. So there are 7 cervical vertebrae. They're the smallest and the most mobile of all the vertebrae. The first 2, C1 and C2, we just talked about, and they're unique. They're not just unique within the cervical region, they're unique within the whole body. There's only one of C1 and one of C2. The rest of the cervical vertebrae, C3 through C7, are considered typical, but when you look at them, each one is a little bit different. So, but C1 and C7 are your typical cervical vertebrae, and C1 and C2 are special. So, cervical vertebrae, the common features of them is, besides C2, because it's special, they have transverse foramina. There are holes within the transverse process that serve as conduits for each vertebral artery coursing toward the brain. So bringing oxygen to the brain, that's very important. It's encased in bone. So the reason for having transverse foramina is to protect the vertebral artery. Cervical vertebrae are bordered posterolaterally by uncinate processes, making them appear like little stackable shelves. So when you look at this picture, you can see how they stack right on top of each other. They're like those little Rubbermaid stools that you can stack on top of each other to make taller. So we have this C7 vertebrae. Most of the spinous processes in the cervical region are bifid, meaning they split into 2 parts. So when I label that in the bony landmark part of the quiz, I don't want you to just say spinous process. I want you to say it's the bifid spinous process of a cervical vertebra. Okay, so on the chart on page 184, they talk about the vertebral canal and what its shape is. They say that the cervical vertebrae are large and triangular. I think of them as sort of heart-shaped. In this picture, they kind of look like little smiley faces almost, but they're large and triangular. There's a big hole because there's a cervical enlargement in the spinal cord, and so they have to be a little bit bigger. The thoracic vertebrae are typically characterized by sharp, inferiorly projected spinous processes that are not bifid, and large, posterolaterally projected transverse processes. The body and the transverse processes most of them have costal facets for articulation with the posterior aspect of the ribs. So if you pick up a vertebra in lab and you're like, I'm not sure what this is, look for those things. Look for the inferiorly pointing spinous process, the posterolateral projecting transverse processes, and the costal facets. The bodies of the thoracic vertebrae are larger than the cervical but smaller than the lumbar. The ribs, thoracic vertebrae, and the sternum define the volume of the thoracic cavity, and they form that bony encasement for your heart and lungs. The apophyseal joints of the thoracic vertebrae are aligned nearly in the frontal plane. That's another way to distinguish them from the lumbar vertebrae. And that favors the motion of flexion and extension. And we'll talk I'm sorry, they're in the frontal plane. It favors the motion of lateral bending, and so it doesn't favor flexion and extension. If they were aligned in the sagittal plane like the lumbar spine, then that favors flexion and extension. So we'll talk about this more in the motion section of the lecture. So the lumbar vertebrae are huge, and the thoracic vertebra, if you look at it from the posterior side, it looks like a giraffe. So the spinous process is its nose, the transverse processes are its ears, and the superior articulating facets are its horns. So take a look at that giraffe in lab and see if you can see it. The lumbar vertebra looks like a moose when you look at it from posteriorly. It has a wide, massive body. It's a major weight bearing for our spine. The spinous processes are connected to the body of the vertebrae through lamina and pedicles, just like all the other vertebrae. And the spinous processes are relatively blunt and small. The facet joints of the upper lumbar region are oriented close to the sagittal plane to favor the motion of flexion and extension, but they transition towards the frontal plane in the lower regions, and that's, we'll talk about that, the implications of that in a minute. The way you can tell a lumbar from any other vertebra is huge body, a round vertebral canal, and that short, blunt spinous process, and relatively short and blunt transverse processes as well. The sacrum is a triangular bone transmitting the weight of the vertebral column to the pelvis. This picture looks at it from the superior surface, the body of S1 that articulates with L5. The sacral promontory is the anterior portion of the body of S1. It articulates with L5, forming the lumbosacral junction. The reason we have this picture looking at it this way is you can see the sacral canal, and the function of the sacral canal is to house and protect the cauda equina. The cauda equina is the bottom of the spinal cord where it splits off into little nerve roots. There, on the dorsal side of the sacrum, there are foramina that transmit the dorsal rami of sacral nerves. The ventral sacral foramina transmit the ventral rami of spinal nerves. So we have a lot of our lower extremity nerves are innervated through the lumbar and sacral plexes, and they come out through the bottom of the sacrum, which is kind of cool. It's nice that we have those holes to do that. This picture, you can see a few more of the sacral features. The ala is the wing of the sacrum, if you want to think of that. The auricular surface articulates with the ilium, and you can see the ventral sacral foramina in this picture. And it has the attachment for the piriformis and the iliacus and some of the other major muscles, which is kind of nice. The coccyx is sometimes referred to as the tailbone. It's a small triangular bone consisting of 4 fused vertebrae. And the base of it articulates with the inferior sacrum, forming the sacrococcygeal joint, which is fused. The coccyx it's an important attachment for a lot of the pelvic floor muscles. And the pelvic floor muscles, basically they help keep your guts from falling out. So they're pretty important.